Hi, my name is Amy Allen. I'm a nurse practitioner providing lactation to support to Agnes, who is a mother of a 5-day-old infant, Olivia, who was born at term and is known to have Down syndrome. So hi Agnes, I understand that you're looking for some support with feeding Olivia. Can you tell me more about how you've been feeding Olivia so far and how you would ideally like to feed her?
So far, I've been trying Olivia at the breast with each feed, but I usually end up giving her express breast milk or a bit of formula with bottles. I'm having trouble getting her to remain latched at the breast. She seems to give up and slip off after a minute or two. My pediatrician has told me that she has hypotonia. Ideally, I would love to be able to breastfeed Olivia exclusively, but I'm not sure that will be possible as I already feel like I'm not producing enough milk for her.
Okay, thanks for sharing this information. Exclusively breastfeeding Olivia is a great goal to work towards and will be beneficial for her for many reasons. So I'd love to support you in this goal. So the first thing to know is what hypotonia is and how it can affect breastfeeding. Another way to think of hypotonia is reduced muscle strength. And when this involves the muscles of the mouth, lips, jaw, and tongue, it can affect Olivia's ability to form a seal and to use her tongue to facilitate milk transfer. The good news is that these difficulties often do improve with time as muscle strength develops. But one way we can help enhance sucking efficiency at this time involves using your hand to support Olivia's jaw and cheeks. So this is done using something called the dancer hold. So to do the dancer hold, you would start with your hand in a typical C hold on your breast, so your thumb on top and your forefingers underneath. And then you move your hand forward so that only your bottom 3 fingers are supporting your breast, and your index finger and your thumb form a U. And then Olivia's chin will rest in the bottom of the U. So this helps support her jaw and also keeps the weight of your breast off of her jaw, while you can also use your fingers to exert slight pressure on her cheeks. And what that does is decrease the space inside her mouth so she doesn't have to suck as hard to exert negative pressure. Another option that you may want to consider if the dancer hold isn't working is the short-term use of a nipple shield. The firmer texture of a nipple shield provides additional stimulation that can assist with getting the nipple back far enough in the mouth over the tongue to help facilitate milk transfer.
Great, I look forward to trying this, but what about the fact that I don't seem to be producing enough breast milk for Olivia? My doctor's concerned because Olivia has lost 10% of her birth weight.
Okay. Yeah, so Olivia may need some assistance with milk flow during feeds in order to get enough to meet her needs right now. So one way we can do this is using something called a lactation aid. So this is a small soft tube that's connected to a container of supplemental milk at one end, and at the other end it rests against your nipple and is slipped into the corner of Olivia's mouth once she is latched. So this is helpful because it provides supplemental milk to Olivia while she is at the breast and working on further developing her sucking skill. Another option to facilitate milk transfer is a breast compression during feeds. So you would utilize the breast compression at the breast when you start to notice that Olivia is no longer actively drinking or swallowing. So when that happens, you would use, again, the C hold with your thumb on top, your forefingers underneath, and you would squeeze down and wait to see if Olivia starts drinking again, which shows that there's more milk flowing into her mouth. Okay? So it's important to know that we talked about a few different interventions today, which can be overwhelming. So if you decide to just focus on one at a time, such as the dancer hold to improve her latch, that's perfectly okay. And it's okay to continue supplementing Olivia with bottles after feeds if that's working for you right now. As Olivia learns to breastfeed more effectively, she will begin to transfer more milk from your breast and require less supplements after feeds. So if you are doing that, it is important that you are pumping a minimum of 6 times in 24 hours so that you can maintain your supply. So if you'd like, we can talk about establishing a realistic pumping schedule next that works for you and Olivia both.
Yes, I'd like that.
Great.